Coleman? Mr. Coleman? You remember me? Remember me?
No.
Okay. I'm sorry, I do remember you. I'm sorry to disturb you. I'm kind of here on my geriatrics rotation, working with the geriatrics team. We saw you about 5 weeks ago now at our geriatrics outpatient site. I'm not sure if you remember that, but okay. I noticed that you had problems with your heart again that led to you being here. How's your breathing?
I can actually lay down now, but I still have to have this up, so I don't choke.
How about that swelling in your legs? You still have that?
No, that's better to it. I think I lost weight.
What type of things do they have you do here for your physical therapy?
Well, mostly it's walking.
Mm-hmm. How did it go? Were you able to get through it?
Well, I did the best I could, which is not very good. But
I do have the physical therapy notes here, and they said that you can go about 20 feet, so maybe halfway down the hall, and that they think you need a walker.
Walkers are for old people. I want a cane.
Okay.
I have more control.
They also mentioned that you may have fallen yesterday. What happened?
Oh, I was getting up to take a pee, and I tripped, I fell, and I hit my head against there, and they wanted to send me over to the ER, and it was baloney. It was just, and the food is, ugh.
What's wrong with the food?
It's got no taste to it. It's horrible. Yeah. They yelled at me. I tried to get salt off somebody else's table, and they told me I couldn't have any salt.
Mr. Coleman, have you gained or lost any weight since you've been here? Do you know?
Yeah, they weigh me every day. And I seem to be losing some weight.
I don't see the weights in here, but I spoke with the director of nursing here, and she mentioned that they might be ready to discharge you fairly soon, and I wanted to get your thoughts about that.
I mean, I want to get out of here, but I don't want to go to any nursing home. I like being on my own. I don't like being, people taking care of me. I don't like being a burden to other people.
I always review your medications, and I don't see a list here, but the question I have for you is most facilities like this, they sort of come by and give you your medicines. Other places, you might have to administer them on your own. How would you feel about that?
Fine, I could do it.
Okay. Well, I see that we do have some vital signs. I do find those in the chart. So we have your heart rate was a little bit up to about 110, and your oxygen level is about 88%. Without oxygen. So you're not using the oxygen, that's good. Before I go further, Mr. Coleman, do you have any questions for me?
Are you here to send me away?
Well, I don't make that decision. It's sort of, it's kind of, the whole team will make that decision. Any family that you'd want to talk to?
The only family I got is Melanie. I will not make a decision unless I have our counsel.
Okay. Why don't we try to involve her in that decision making? My job is to figure out how well are you getting along, and where would you be safe. But the ultimate decision is sort of the whole team comes together and makes that, including you. I'm going to leave right now, but I will come back, and hopefully we can time it so Melanie is here. It was nice to see you again, Mr. Coleman. I'll be back shortly. Mr. Coleman, it's Dr. Farrell again. I brought Melanie along with me.
Oh.
Hi, Dad. We missed you today.
Yeah, I missed you too.
Well, I had just had an opportunity to talk with the director of nursing, and it sounds like they're getting ready to discharge him from this facility.
Really?
Mm-hmm.
Oh.
Was that ever communicated?
No. It's the first I've heard of that.
Okay.
Huh, who knew? You ready for that?
I want to get out of here, but I don't want to go to no nursing home.
Right. Well, no, we don't want you to go to a nursing home. We want you to come back.
And how about you, Melanie? How do you feel about him going? If you were to go home today or tomorrow, how would that sit with you? Would you be okay with that?
Well, I mean, I do have a concern with him being home alone. especially since yesterday. So I don't know what to do about that yet.
Okay. Well, we're not going to make a decision right this minute.
Okay.
But Mr. Coleman, what I'd like to do, if you could just sort of show us how you've been walking. So can I have you just kind of get out of bed on your own and see sort of how that goes, and then we'll just walk down the hall a bit, come back, and then we'll chat some more.
Okay. Oh, Jesus.
Do you feel like you can go further?
I need my cane.
Okay.
Get my cane for me.
How about the walker?
Well, yeah. They want you to use the walker, Dad. Can you use
I don't
that?
want no freaking walker.
Okay. Why don't we just each get an arm on VA here at least?
Can we just use the walker just while you go down?
No!
Just down the hall, Dad.
I don't want it.
Okay, why don't we come on back? We'll go nice and slow. Nice slow turn. Melanie, can I have you on the other side of him? Okay. Come on this way. We're going to try to get you back in bed. I think, Melanie, would you
Gosh,
be able
Dad.
to...
You weren't like this the other day.
Melanie, why don't you hold on
Wait a
to
minute,
your...
hold on for a second.
Hold on, no, let him catch his breath. I'm going to lower the bed
Yes,
so
that'd
we
be
can get him
great.
back in.
Thank you.
Melanie, do you have a hospital bed at home?
We don't.
All right, that's enough.
Is that good?
Stand up straighter, Dad.
You
You're such a grouch.
worse than those nurses. Oh.
Mr. Coleman, you look a little short of breath. Do you feel that way after getting up out of bed?
It's, it's not as good as I like, but it's not, it's not terrible.
So the director of nursing was talking about discharge, and one of the options that I know that Mr. Coleman expressed to me that he prefers is going back to his senior apartment. And I want to get your sense of that.
You know we love you, Dad. And that's never gonna happen.
What are your concerns?
Well, he's alone too much, and I'd rather, him have partial supervision than none at all.
I think that's one of the things we would worry about, frankly, going back there, is your safety. Have you had a chance to discuss that?
Yeah, my husband and I did talk about it a little bit. And so, the places that we found are, not that you're not worth it, but they're just not in our budget right now.
So this is often confusing for families, and that might or is not likely to be covered by his insurance.
So his long-term insurance, it won't be covered in, won't cover any of that?
I'll need to ask you to contact your insurance agency on that. Do you have any questions at this point, Mr. Coleman? I know we've talked about a number of things. I want to make sure everything's clear. We talked about where you might eventually go after your stay here is completed.
Oh. The only thing, I don't want to go to a nursing home. I'm not ready to die.
Well, I don't want you to go either.
Okay.
Okay?
Well, I think we share the goal of keeping you as independent as possible for as long as possible, and the question is, how do we get there? So I'm going to step out for a moment, just talk with our team, and
Okay.
when I come back, we'll hopefully have some more concrete plans
Okay.
to share with you, okay?
Okay, thank you.
You're welcome.
The expenses are going to be out of sight.
Oh,
Hey, hello again.
hi.
Hey, so just had a chance to chat with the geriatrics team, and also ran into the director of nursing. Then we talked about sort of the long-term care facility option right now.
What's a long-term care?
Well, that would be something like a nursing home.
Just a fancy word for what you hate.
Yeah. I think what I'm going to do is let the two of you sort of think about some of these options. I don't have all the answers today, but we'll be back tomorrow, and we can review this and see kind of where we're at, okay?
Yeah, thank you.
All right, so it's nice to see you, Melanie.
Thank you.
Mr. Coleman, it was really nice to see you again. I'll be back tomorrow.
Great.
Okay.
Good, thank
Thanks.
you.
You're welcome.